can I also ask about Google, and maybe it's Google Cloud has a relationship with some of the larger health systems, Mayo, Ascension, and recently signed some kind of partnership arrangement with HCA.
Yes.
Can you just give us a real quick thumbnail sketch of what the purpose of those partnerships is?
Oh, definitely. Yeah, we already had stronger partnerships with the healthcare ecosystem before. It's kind of typical, right, for tech and healthcare to be partnered up. So I emphasize a lot the new public health piece, but we've continued to progress in our work in Google Health in partnership with Cloud with those partners that you mentioned. The product and services work there is a mix of things. It's spanning what we call a tool we call Care Studio, which is a tool we're developing right now with Ascension that is a user interface for the electronic health record that makes that data intuitive and useful in the way that we've made the world's information intuitive and useful through search. I'm overplaying it, but that's the vision. We're not all to that place right now, but where we're trying to get is something that feels familiar, light, airy, intuitive, and helps with the experience of retrieving and documenting in the EHR. And we have other partners interested in doing that with us beyond Ascension. We're also with Cloud and trying to understand how we can help our partners with analytics and with prediction models. So leveraging some of the AI and other tools to help them do some forecasting work. There's some good examples of how that's happened during the pandemic, particularly around COVID, but there's other work that we've worked with, that we've done in that space. And then the other big bucket I should mention is work that we of applying AI, particularly to diagnostics and therapeutics. Again, with all those partners, the example in the NHS is we've been working with them on mammography readings. So can AI augment the reading of a human radiologist to give a second read and accelerate the time till the woman gets her results? In the UK, the NHS requires 2 reads. And having enough radiologists to keep up with that causes some delays in the system. We're doing memo work with Northwestern Medicine right now and some other places also. We're doing work with Mayo and therapeutics, with radiotherapy in particular. So is there a way that we can accelerate the work of radiation therapy for head and neck cancer to identify what's the right field to radiate? And these and other examples in diabetic retinopathy and our work in pathology in general, I think speak to not only the power of AI, but also the importance of computer vision, which is a tool. They're related tools that just, when you take an image, right, can we help advance the diagnosis of that condition and accelerate the pathway for the patient? And can we also help in the space of treatment? So those are some examples of the ways that we're thinking of being helpful with those healthcare partners.